We have some really great speakers lined up for you today, and we're going to provide significantly more detail than we were able to provide yesterday at the press launch event for the campaign. And we're leaving some time at the end of the webinar for Q&A with all of you. So if you have questions as we go along, please type them into the chat, and we have a moderator who's going to be collecting those questions and fielding them to the different participants. So if you have a question for a particular speaker, just make sure to note who your question is for, and we'll make sure that we get to those. But without further ado, I think we can continue on to the next slide. The plan for today is just to go over who we are and the organizations that are present, then to talk a little bit about opioid use disorder as we understand it, the current state of it in Pennsylvania. We're going to give you a lot more information about the campaign strategy for Life Unites Us. Then we'll go into a discussion about how we anticipate working together. And again, we're very interested in hearing from you all, your thoughts on working together as well. And then, like I mentioned, we'll have some time for questions and open discussion toward the end of the webinar. And then we'll finally close with just some closing remarks and some next steps. We can go ahead and go. Oh, thanks. So with us here today, there are a lot of individuals, and just to manage time, we're not going to go through everyone on this slide. But myself, I'm Dr. Joe Smizer. I'm the Chief Executive Officer of PGP, or the Public Good Projects. We also have Dr. Westing Kensinger, who is an Associate Professor of Health Education and a director at the Institute of State and Regional Affairs at Penn State. We have Gary Mendel, who is the Chief Executive Officer of Shatterproof, and we have Secretary Smith from the state of Pennsylvania, and specifically the Department of Drug and Alcohol Programs. Each one of those individuals will be walking you through a particular subset of slides in this webinar, and you'll hear from me occasionally throughout the course of the webinar. So those are the individuals who are speaking today, but the campaign, as you see here, is really about Pennsylvanians. As was noted yesterday, this campaign, the message of the campaign are people, and people are the messengers of the campaign. This is really about from the community up, not the state down. That's how we've designed this. And we have an example here on this slide of what the campaign is going to look like, how personal experiences will be woven into what you see on the social media channels or on the website or in messages shared by community organizations or the state. And I believe we have a video queued up just to give you a sense of when we say testimonial and story, what that actually entails, what that looks like.
My name is Pedro. I'm 34 years old. I've been in recovery for the last 3 years. I currently work for the Community Wellness Engagement Unit as a certified peer specialist. I experimented with different substances, opioids being one of them. I'm a walking testimony of what the continued use of opioids and opiates can do to people. For the longest time, you know, addiction was looked at as a character defect. Today, it is being acknowledged and understood as a disease. If opioid use disorder was destigmatized, the positive outcome that will come out of it is less incarceration, less deaths, and more people taking in and going to get the help that they need. There's still people that I know to this day who are in denial to an extent simply because of the stigma. You have to want it, and it's okay to ask for help. It's one of the biggest things that I advocate for. It wasn't until, you know, I gained the courage and and had the support to say that I'm a person in long-term recovery. Be true to yourself and just understand that you're not the only person that's going through this.
So as you can see, these stories are not scripted. These are average, everyday people, our friends and neighbors and coworkers, our family members who live in Pennsylvania, who have a personal experience with addiction, and who are incredibly brave individuals and who are interested in sharing their experience with everyone across the state, in the hopes that by sharing themselves and their own experience, it reduces the stigma of addiction for everyone. So they just set up their camera and they say what they would like to say, and the campaign's role is just giving them a platform to do so. So I think we can go on to the next slide. We've broken up this presentation into several sections. And so you'll see these title slides as we continue. Next up, we're going to walk you through why the focus on opioid use disorder and the stigma related to it, the national stigma strategy from Shatterproof, the baseline results that Penn State has run, more information about the collective impact model, more information about what's called the contact-based strategy that informs the approach of the campaign, and the work that's been completed to date. But to start us off in this new section, I'd like to pass the baton over to Secretary Smith.
Great, thank you so much, Joe. Hi, everybody. So good to see you. I'm not seeing you, but thanks for the messages in the chat. I miss seeing a lot of you. Fortunately, I've been on events with many of you during the month of September. That's so great. Thanks for joining us today. What I'm talking about, it feels a little odd to talk about with you all because I think you all know this stuff probably better than I do. But just to set the stage for why we're embarking on this campaign, why are we addressing stigma in Pennsylvania? There's sort of two facets that I want to talk about. First is from a data and a statistics perspective. And then the second is more from a strategic visioning perspective. So in terms of statistics, I think most of you know that we are losing about 13 Pennsylvanians a day. We have made some progress in overdose death rates in the last couple of years, 18 and 19. We both saw declines. Unfortunately, it looks like in 2020, we're looking at increased numbers again, and most of you are very familiar with all of that. Losses in your recovering communities and unfortunately a death. So that's not new information to any of you, but 13 Pennsylvanians a day is far too many. In terms of the overdose deaths that we are seeing, we know that about 82% of those deaths involved opioids at some point. Now, we all know there's a lot of polysubstance use. We know there's a lot of commingling of substances. We know there's an increased use of stimulants, particularly methamphetamine. But still, 82% involved opioids in some way. And so we know that there's clearly still an issue here, and we need to do something about it. So strategically, our department came up with a plan last year that included 4 goals. And those goals were to reduce stigma, that was the first. The second was intensifying primary prevention. The third was strengthening our treatment system. And the fourth was empowering the recovering community and empowering sustained recovery. What's really interesting about that plan is that really the first goal of reducing stigma underpins the other 3 goals. Let me explain that kind of briefly here. So when you talk about primary prevention, if you really want to see the impacts and the positive effects of prevention, You have to have individuals in communities who are willing to embrace that messaging, that philosophy, to hear the messages, to say the messages. And unfortunately, because of stigma, what's happening? We're not sending the messages as clearly as we need to. We don't have parents and communities who are as willing to openly engage in that dialogue because of stigma. In terms of the goal around strengthening our treatment system, we've got folks who are hesitant to access treatment because of stigma, coming from lots of different places, employers, family members, etc. And we've got people who are hesitant to accept medication as part of their treatment regimen. And we know that for opioid use disorder, medication-assisted treatment is really the gold standard of care. So some of the things that we're going to work on with that goal, really, the root of stigma is going to impact how successful we are at achieving that. And then the fourth and final goal was around recovery. And, when you think about successful recovery supports, you think about things like employment and transportation and housing and good family or community supports. And stigma really has a big part to play in how successful some of those relationships are, in terms of getting a job, in terms of getting a loan from the bank in order to purchase a car to have transportation, and the relationships that you have with your family and your community. And all of that ultimately drives how successful your recovery support network is. So, really when you kind of boil it all down, why are we doing it in Pennsylvania? Well, the numbers are bad. We're losing too many people. But beyond that, if we really want to make progress, significant, lasting progress, we have to address the root issue. And to me, the root issue is stigma. So all that to say that a couple of years ago, I was having this similar conversation with Gary Mendel from Shatterproof, and he just so happened to be talking about how he was chipping away at this from a national level. And so the two of us were able to have this great conversation about what it might look like for Pennsylvania to take part in that movement that Gary has started from a national perspective. So this is a great transition. At this point, I'm going to shift the presentation over to Gary and let Gary talk a little bit about what Shatterproof has been doing.
Good afternoon, everyone. Secretary Smith, thank you. If I can amend one thing, if I could agree with one thing that Secretary Smith said and amend one thing. What I wholeheartedly agree with, and I don't need to say any more because Secretary Smith said it, is the impact that stigma is having on families in Pennsylvania and across the country. We all know what the opioid epidemic is doing to ravage families across our country. But what's really not clear to most leaders in the field is how stigma really is one of the key drivers of this devastation across our country. And there I would agree with everything Secretary Smith said. Where I would amend it would be where Secretary Smith said, why are we doing this in Pennsylvania? Secretary Smith listed a lot of reasons, but I'll give one more. And the one more is because Secretary Smith and other agencies within Governor Wolf's administration are taking a leadership position on this. Secretary Smith listed all the reasons why stigma is important, but there's not 49 other states doing this. There's one that's leading this off, and that's leadership. And that's leadership by Governor Wolf, that's leadership by Secretary Smith, Weston and Joe. You heard Joe, you'll hear Weston. There's some real leadership here why Pennsylvania is going to be the first state in the nation to implement this program. I just want to acknowledge that. Secretary Smith, thank you. So big picture, Secretary Smith mentioned Shatterproof is a national organization dedicated to reversing the addiction crisis in the United States. And when we looked at all the things that are driving the addiction crisis, it's quality treatment. It's getting people to the right type of treatment. It is adding more funding to the treatment system. It's payment models. There are various things, a variety of things that are driving this epidemic and causing many families to be in a cemetery, burying a loved one they shouldn't have to do. But the one big driver that has been generally overlooked is stigma. And that's why a year ago, Data-Proof approached McKinsey and Company to work with us to really develop a national plan to reduce stigma. Not just a little Band-Aid, not just a few messages here and there, but a real national framework to reduce and ultimately end stigma around this country related to this disease. And what we did over the last year, we worked with McKinsey and Dr. Smizer from the Public Good Projects, and we studied 11 social movements that have been successful in this country over the last several decades. 11 movements. We studied, we researched over 100 pieces of published literature. We had interviews with 50 experts who went through other social movements. And we pulled out from those 6 key success factors. What things worked, what things didn't work. We pulled out 6 key success factors. Number 1, central coordination, which you're seeing on this call. And as Dr. Smizer said, those presenting on this call are leading it from one perspective, but the rest of you who are joining this call are really the power to it. It's local organizations that are going to make this happen. So it's coordination between all of us, which we're doing on this call. Number 2, specific actions included educating, policies, and language. You're going to learn more about that later in the presentation. Number 3, the education policies have to be, or programs have to be a certain way, contact-based strategies. I know there's going to be more information about that in the next few minutes. Intentional sequencing. We can't do the whole country all at once, doing everything. You know, all education, all policies, all language. We got to start with several stakeholders, a few states, some companies, and some other coalition members. Build success and leverage it. Positive and negative incentives. Call out and give credibility and recognition to those states, companies, healthcare entities that are doing the right things. And lastly, as I talked about, central coordination. It is top down and bottom up. To address, so that's the key success factors. Just to wrap up, what we're doing is there are 4 types of stigma. And this campaign is really going to focus on mainly 2, but we're going to be touching on all 4. It's public, what people in the public feel and think about those with this disease. It's structural stigmas, how our policies, whether it's hiring, firing, renting apartments, going into healthcare versus a criminal justice system, those are structural stigmas. Self-stigma is what the killer is. It's what people feel who are addicted. It's how they internalize what those messages are and start to feel about themselves. As we reduce public stigma and structural stigma, it will automatically begin to trickle down and reduce self-stigma. And lastly, it's been touched upon by Secretary Smith, the stigma against the medications. There's 3 FDA-approved medications. They absolutely improve outcomes. We're going to be focused on reducing the stigma against those as well. So Secretary Smith, thank you for your leadership, bringing this together, bringing us all together. I'm now going to turn it over to Weston Kensinger from Penn State University. And as I mentioned, just joining this call, my daughter goes to Penn State, and so I'm always getting the "we are" in the mail. So turning it over to Weston.
Great, thank you, Gary. I want to echo what Gary just mentioned. We're very, very thankful for all the leadership that Secretary Smith has provided for this campaign, the Wolf administration, and the work that you're doing, Gary, as well. It takes a lot of courage, time, and dedication to make a national strategy, and it's not easy to do. But what you're doing is, it's not just going to change lives in Pennsylvania, it's going to change lives throughout the nation and throughout the world. So thank you so much for doing that. And this programs like these do not happen in a bubble. So PGP they've done great campaigns throughout the nation. More recently, they did one in New Jersey focused on mental health. So we're using one of their models for this campaign. We have a really great team assembled for this. But when we start thinking about, campaigns, one of the things that people often forget is the evaluation piece, right? We're focused on making the graphics look good, having a, snazzy tagline, well-produced videos, and all those things are very important, but we also need to evaluate the effectiveness of these campaigns. And it's no surprise to anybody that stigma is pervasive, across the nation. And it's pervasive across Pennsylvania. If you had a chance to watch the live stream press event yesterday, look at some of the comments in there from people. Right? Stigma exists. So we need to work to change that. So to evaluate the program and also kind of help guide the program, one of the first things that we did was we reached out to the 47 single county authorities throughout the state of Pennsylvania and asked them to connect us with community-based organizations in their respective county or counties, because we really want to take a grassroots approach to this, make sure that, people's voices are included in the campaign and that they're heard in the campaign. So it's not a top-down approach. We need your help. I know Joe's going to talk about that in a little bit with the collective impact model, but it really starts with the people on the ground who are fighting every day to reduce stigma and help those affected with opioid use disorder. So we reached out to these community organizations. We then developed a stigma survey that we fielded throughout the state. So this was done back in the summer, so June and July. And the survey was approximately 60 or 70 questions. And we worked to distribute the survey out across the state using a quota-based approach so that we had a representative sample from across Pennsylvania, so that we can ensure that, their voice is heard from Northeast, Northwest, South Central, and all the 6 regions across the state. In this baseline surveys, one, it kind of helped us to establish, okay, here's where we are right now. Here's what we're seeing. How are we going to design a campaign, right, based on these results? What's going to be effective? What is needed? In June and July of 2020, again, across the state, it was a representative sample of adults throughout Pennsylvania. And we wanted to find, what are the baseline measures of stigma? Where do Pennsylvanians stand? What are their attitudes? What are their beliefs? And we had some pretty interesting findings from that survey. I'm not going to go over in detail all the findings. We have, I think, it's like a 74 or 75 page report about that. And we're also going to be putting some of the results of the survey on the dashboards that we're developing as part of this campaign as well. One of the things that I definitely wanted to mention was, some good news is that most Pennsylvanians believe that the opioid epidemic is a serious problem, but that people can actually recover from it. 92% of Pennsylvanians believe that, people with an opioid use disorder can recover to, live full, fulfilling lives. Throughout the state, about 40% of Pennsylvanians said that they had a family member or close friend who suffered with OUD, and that's less than the 60% who say they have a family member or close friend who suffer from SUD in general. We found that nearly 60% of respondents reported they would be unwilling to live with someone living with an opioid use disorder. But about half of the respondents said they would be willing to live with somebody in recovery. So there's definite division right there. And what we want to see is we want, to reduce the stigma around opioid use disorder, improve a lot of these numbers. A lot of times we hear about when, new treatment centers are going in. Sometimes people in the community are not very receptive to them, again, because of the stigma that is placed on people with substance use disorders and opioid use disorders. However, we did find that only 30% disagreed with the statement, "I'll prefer that opioid treatment centers not be located near my home." So that's definitely good news. One of the things that really stuck out with this survey was that Pennsylvanians with a history of opioid use disorder reported unfair treatment because of their opioid use. They've reported being treated unfairly by family members. About 60% of them reported unfair treatment by family members. 47% reported unfair treatment by friends. And about 44% reported unfair treatment by law enforcement. Even if 1% is reporting this, that is much, much too many. So we really have to work at, decreasing the stigma throughout the state so that people are treated fairly for the disease that they have. The pervasive thought that opioid use disorder, substance use disorder is a moral failing is just completely wrong. However, we have to help people understand that and show them that it is, a medical disease that can actually be treated. So these are just a few highlights from the statewide survey. We're going to be running the survey again in approximately 6 months to see how, has this campaign had an impact across the state? Are we seeing changes that we want? If we are, great. We're going to keep doing what we're doing. If we're not, we're going to say, okay, where do we need to come back, and maybe make some small tweaks to the whole campaign so that we can make it most effective. So we're going to run follow-up surveys every 6 months so we can really establish, some evidence as to the effectiveness of this campaign. Because I think that, we really want to focus on Pennsylvania, but we also know that we have this opportunity because of the people on our team to make this a model program for the nation. And to do that, we have to show effectiveness with that. So these surveys are very, very important. We're also, collecting qualitative data through interviews with people across the state. I know the team at the Institute of State and Regional Affairs worked very hard reaching out to people across the state and getting interviews done with them so that they can kind of find some of the nitty-gritty details about stigma that weren't addressed in the survey. So we really look forward to continuing the evaluation of this campaign so that we can make sure that it's as effective as possible for all citizens across the Commonwealth. And this isn't something that Penn State does, that Shadowproof does, that PGP does, that DDAP does, right? It takes all of us, and it really takes people on the ground level buying into the campaign, partnering with the campaign, right? And being representatives in their own local communities, right? To help people there reduce stigma. And I know that Joe's going to speak next a little bit about the collective impact model and how that works.
Thanks, Weston. Can you hear and see me okay? Okay, great. Well, the collective impact model, well, first of all, thank you all also for finding your way back to us today. As Weston said, it's still 2020. So we'll keep going at a good clip so that we can still end on time. The collective impact model is a huge part of how this works, but the essential part, the part that's really from public health research and the evidence base on reducing stigma is called a contact-based approach. And so that sounds a little fancy and opaque, But all a contact-based approach actually means is you show someone who has a lived experience with a condition or has been impacted by a condition or an experience, and they express that experience to someone who does not believe that they live with the condition or is not aware of having been touched by the condition or by the experience. And so you build common ground between those two individuals. The person who has experience with the condition humanizes the condition, and through sharing their own story, because we are social creatures, the person who has limited experience with the condition learns about the condition and also sees that it affects people who are just like them, their friends, neighbors, and coworkers, and family members, their community members. So it's a really simple concept, actually, that if done correctly and in a very particular way as a public health intervention, has been shown time and time again to lead to actual measurable changes in knowledge, attitudes, and behaviors at a population scale. There are certainly ways to do it incorrectly that deviate from the evidence base for a contact-based approach, but that's part of why we spent so much time doing the lit review, talking to subject matter experts. It might seem overly simple to put someone in front of their webinar and have them explain their story, but the way that they're telling their story, the fact that's going along with that story, and the way that that story is being placed in front of very particular populations in the state and then being evaluated in those same populations, the network of us working with you all the community organizations who know populations in the state better than anybody, that's really where the contact-based approach shines and leads to impact. So particularly, it leads to impact when we're talking about stigma, which of course is what this campaign is all about. So you've seen, of course, testimonials on other topics. For example, they're widely used in tobacco control campaigns. But when it comes to stigma, that's where the contact-based approach really shines. It's much easier to have a stigmatizing view of a condition or a group of people if you don't know someone who lives with a condition, if you don't know someone who's been impacted personally by the condition or by the experience. So putting a face to things really matters. I think we can go ahead to the next slide. The collective impact approach that Weston touched on. So we have this contact-based, evidence-based strategy. How does that get articulated in the state? That's the collective impact approach. And you can see it here. It's another kind of deceptively simple approach, but this is basically public health 101. We know that public health works best when everybody's engaged and has equity in the topic, equity in the issue. They have a role to play. So collective impact is a fancy way of saying, actually do talk to community organizations, actually listen to them, have them tell you what they need, give them what they need, and make sure that government and academia and public health nonprofits and community organizations in the addiction space, they all understand what the campaign's about, they all have a role to play, and they're all working toward the same end. And that's the work that we've done leading up to the launch, which was yesterday, the formal launch, and that's the work that's going to continue moving forward. That outreach to you all and to other organizations is going to continue to happen every week, week after week, throughout the lifetime of this campaign. You can go ahead and move to the next slide. There's been questions about the evidence base that this is pulled from. As I mentioned, there's a lot of evidence around a contact-based approach reducing stigma. A lot of that work comes from the field of mental health, which maybe at first blush doesn't seem like it's related to the stigma of mental health, to the stigma of opioid use disorder or the stigma of addiction, but they're actually really closely linked to each other. So researchers who spend their careers studying stigma will tell you that stigma of mental health conditions is is manifested almost in an identical manner in communities to the stigma of addiction. The way people perceive individuals who live with mental health conditions, the stigma keeping those individuals from receiving treatment, feeling like they're a good community member, staying in treatment. There are so many similarities with people who are living with addiction and the stigma that they experience in their communities, and then that they internalize in themselves. So that similarity continues all the way through to interventions, to public health interventions. The way that we measure stigma in communities in both mental health and addiction are almost carbon copies of each other. If you look at the peer-reviewed research on measuring stigma and then reducing stigma in the mental health field and the addiction field, almost identical. So we took the best evidence from the mental health field, which has been around a much longer in terms of its focus on stigma than the addiction field, especially the opioid use disorder stigma. And we took that and we applied it to opioid use disorder stigma. So this campaign is modeled after a campaign that's still running. It's been running for just about 3 years now. That's across 8 states in the District of Columbia, using almost identical measures to how Penn State will evaluate Life Unites Us. And what we found there was using a contact-based approach, making sure that everything was modeled after a collective impact model. There was room for everyone to engage and have a role. That led to, across many measures of stigma, the same measures we're evaluating this campaign on. There was an average 8-point reduction in stigma. If you're a public health person, that's a huge number. That's a number that you wish you'll see, but likely never will. That happened in a year's time, so incredibly fast. And that's been peer evaluated and reviewed externally. And it led, if you extrapolate the numbers, that's about 7 million people having less stigmatizing views of individuals who live with mental health conditions. So again, just taking the best that we learned there, the best that works, and applying it to Pennsylvania, and making sure that it fits within the state's priorities, the national priorities around addressing stigma and the opioid epidemic, that it all fits together and it all makes sense, that nothing's working against anything else. And as many of you who have been in this field for a long time can attest to, marketing campaigns or campaigns that are just trying to raise awareness often don't take the time to integrate into states' existing plans. They don't take the time to talk to community-based organizations and work together every day. They certainly aren't rigorously evaluated to the point where an evaluation can be published in a Tier 1 academic peer-reviewed journal. So this is checking all of those boxes. I think we can continue on. So what we've done to date, this is all done really closely with Penn State. Some of this work PGP did, some of this work Penn State has done. The literature review's done. We have already reached out to a lot of stakeholders and community organizations. As I mentioned, that work is continuing. A lot of you have already spoken with someone involved with the campaign. The baseline evaluation's been concluded, as Weston said. Market research has been done on all of the different audience segments across the state and how they would like to see messaging and where they're spending their time, how they get their information. 300 community organizations have already been spoken to and have already given a needs assessment in total. 80 are actively engaged, and we expect that number to increase. 115 people have been talked to by the staff, collecting testimonials and stories. 65 have already scheduled their story to be recorded. And actually well over 40 now have already had their story recorded, and it's edited and complete and ready to be shown throughout the state. And so again, those numbers will continue to tick up every single day. And we've had, which has been really great to see, no shortage of individuals who want to share their experiences and doing so knowing that they're doing it to lower the stigma of individuals like themselves across the state. So it's been really powerful to see those stories come in. Very raw, very real. We're going to now move on over into just the overall objectives of the campaign, what the campaign's activities actually look like, so more the nuts and bolts of Life Unites Us. We knew that there would be some questions about what exactly are you saying, what are the facts going to relate to, so we have a little bit of information about that, and just kind of the overall campaign timeline. So the campaign's objectives, this is going to be a little redundant because Weston already mentioned it. But again, changes in knowledge, attitudes, and behaviors, or if you're a public health person, KABs. So increasing knowledge about opioid use disorder. Recovery is not only possible, but it's probable, it's likely. Changing attitudes toward those living with or in recovery from opioid use disorder, and then behaviors. So increasing people's feelings of self-efficacy, that they know what to do, that they know how to help, how to provide support, and then their self-reported instances of actually having provided support. All of these measures are, for the most part, peer-reviewed. They're validated measures that already exist, and our job working with Penn State was to put those measures into a survey instrument that would be fielded prior to the campaign's launch, at a midpoint, and then at an end point, making sure that it went through an institutional review board and everything was done the right way, so that this could be published and the campaign would be held to a very rigorous standard. The stories and the information and the facts are going to be put out through the state in a number of ways. So of course, with it being a campaign, we have traditional PR, as you would expect. There's a campaign website, and there's social media accounts for Life Unites Us. Pretty normal, what you would expect. That's being sent out to the general public and regional communities or audience segments if you're a marketer. We also have digital influencers and targeted paid media. So what that means is there are individuals in Pennsylvania who have outsized influence on different social media sites. Those individuals are being reached out to, and they will share people's experiences on their own channels to reach the people who are already following them. So that's fairly innovative. There'll be quite a few people who have influence in social media who will be involved, and that work has already begun and will continue to happen throughout the course of the campaign. And again, they're being used in a very specific way. The people who already pay attention to them are the intended audience for the messaging. And then, of course, we have community-based organizations, many of whom are represented today on this webinar. You telling the campaign what you would like, you receiving it, and you also being willing to share the stories, those personal experiences with the people who already know and trust your organization and view it as authentic and credible already is hugely important, and the campaign won't work without a lot of engagement and back and forth with all the community organizations that have been in this space for in many instances, a long time, and no one knows the community better. I think we can continue on. Messaging. So we have a primary audience and then a secondary audience. That's sort of how the staff behind the campaign have been thinking about this. So for the primary audience, recovery is probable. Recovery is likely. It's not just possible, it's probable. Reducing stigma makes recovery more likely. Addiction is a treatable medical condition, and people living with addiction are just like everybody else. I think to those of us who have worked in addiction for years, these again may feel deceptively simple, but as Weston showed, surveys consistently report back that even though we believe these very strongly, and we see examples of these every day, most people out there in the world, this is still new information to them. And then secondary audience, so people in recovery, allies of people in recovery, and stakeholders of people in recovery, giving them a space that is a supportive community space where they can share their stories free of stigma, free of judgment, and support one another is absolutely critical. So you have members of the general public receiving these messages and being exposed to them, and at the same time, the channels where the messages are being placed are places where if you have a personal experience with yourself or with someone that you know and love and care about, you can talk to each other in those spaces and find support there, and a willingness to share and an openness that we know is absolutely critical to reducing stigma. So each and every story, this is really about volume. There's an estimated 300,000 people who live with substance use disorder in Pennsylvania. All of them have a story to tell. Our job is putting all of those stories in front of people across the state. I think you can, thanks. The campaign timeline, you can see launched officially was yesterday. We have our campaign kickoff, which is today, September 29th. We have already been collecting testimonials or stories. That's going to continue, as I've mentioned. The baseline has already been done, so that's what we're going to compare our evaluation results to before the campaign started. So we had a really clean baseline. About 6 months into the campaign, we will do the same survey over again, and we'll compare people's answers to what we found before the campaign started, and then we'll do that again a year in. The web portal that Penn State is setting up is going to be a tremendous resource, we think, and in the state there'll be a lot of new information there, a lot of resources, trainings available to community organizations and interested individuals that did not exist prior to the campaign, so I think that's really exciting. Especially the map function that links you to services in your community. I think that's going to be hugely helpful to a lot of people. And then when we approach the end of year one, there'll be the formal write-up of the evaluation, and what manuscript writing means, it means it'll go through the peer review process. And again, the whole goal of this is, if you are a researcher, if you are someone steeped in stigma and steeped in the world of addiction, can this campaign be presented to you on a stage and leave you with the feeling that you want to give it a standing ovation? So that's the goal. That's what we're working backwards from. I think we can go ahead and continue on. So now we're going into, I think, the final section, and that's how do you join this effort? What trainings and resources are available? And what looking ahead, what can you expect to come? And I think for this section, I'm passing it off to Maddie Morales.
Yep. Hi there. My name is Maddie Morales, and I am the Collective Impact Coordinator at the Public Good Projects. And I've had the pleasure of speaking with some of you, so thank you again for being here. My whole role is to connect with community-based organizations and really understand how this campaign can further uplift your work and better connect with your communities. So I've already been incredibly inspired by the stories I've been hearing from the organizations that are already deep in this work throughout Pennsylvania, and really look forward to further connecting with more of you. So just wanted to share today how you can get involved right after this webinar if you feel so inspired. And starting with the sharing stories that Joe was speaking of. So we are looking to our community-based partners to help us spread the word to your communities, your friends and family, your colleagues, to share their own stories so that we can make sure this campaign is reflecting the stories from your communities. And we also have a team of recruiters who are working one-on-one with people who feel ready to share a story. And also wanted to make clear that we're not only looking for stories from people who are living with OUD, but also allies of those people. So looking to highlight lots of different experiences. And if you want to slide to the next slide here. And then we will be looking for your support also in sharing those stories back out with your communities. So once we have them and have them recorded, we want to make sure they're being shared. So we're able to send you relevant content and then for you to share on your platforms. And then on the next slide, you can see where on the website you can, there's this really awesome video that if you scroll all the way through our website, where you can not only find information about how to submit your story if you're ready or connect with a recruiter, but then all the way at the bottom, there's a place to request content. And that is an easy form that Caitlin will also drop in the chat right now for us to get to know your organization a little bit better so that we can better tailor what types of assets and videos and stories that we can share with you. So definitely fill that out if you are interested in getting information from the campaign. This is some examples of the types of resources that we can send to you. So campaign videos like the one you saw before, simple messages around fighting opioid stigma, and stories. We have a really cool partner logo we'd love to have you add on your site if you're interested, and then other resources to just help get the conversation started around stigma. And then another opportunity to engage with that campaign is through monthly trainings. So we will be hosting monthly webinars, and next time we won't kick you off in the middle, I promise. And this is all to build programming specific to what you are looking for and your needs. We're going to continually evolve this list based on the conversations we're having with you. And these are some of the ideas and things we've been hearing so far. So locating resources, voting and advocacy, social media, how to use it and harness the power of social media, stigma in medicine, medical care and treatment. And through these trainings and webinars, we're hoping to get to know you better and to better connect you with other resources happening throughout the state. So on the final slide here, just a recap of how you can stay engaged with the campaign throughout the year. So join our monthly webinars and share your feedback in follow-up surveys. We'll be sending a survey to you also after this one. And that's a great way for you to be able to share your opinions and ideas about what you'd like to see. Sign up to receive the monthly newsletter. If you're on this call right now, you will just get it automatically. So make sure you check your spam folder for an email from info@lifeunitesus.com. We'll give you access to the partner social media content, like the stuff that we just looked at. And then we'd love to hear more about the programs and events that you're working on throughout the year so that we can also share that out with the campaign network. We hope that you'll be able to learn from other people across Pennsylvania, and we hope that you'll continue to check in with us and me. So my email is right there on this slide here, madelinemorales@publicgoodprojects.org. That's the best way to get in touch and share any feedback or ideas for the campaign. So I look forward to connecting with all of you, and thanks for being here today.
At this point, I think we can go through a couple questions. Maddie, I'm actually going to turn this one over to you. John asked that RCOs in the strong recovery community in Pennsylvania have worked diligently on developing platforms and addressing stigma in their communities, and asking on how our organizations have collaborated and are collaborating with the recovery community organizations, and then also the recovery community in Pennsylvania on message delivery.
Yeah, well, as I mentioned, I'd love to be in touch with you and learn more about the work that you're doing, and also help us help you in sharing the stories. So we want to know what's important for your community to hear, and who in your community can help share stories, and who can we highlight on our campaign and then share back with you. So John, I'd love to be in touch with you.
I'd also mention this is, oh, sorry, I didn't realize John, great question. We have a list of the organizations that we've we've already reached out to. Some of them have formally endorsed the campaign. Their logos are on the website, the homepage of Life Unites Us. How it worked was before we started anything with this work, but before we settled on messaging, before we designed the strategy, we sat down with Penn State and with DDAP, and we put together a list of all of the organizations that had worked with the state, all the organizations that had worked with Penn State, and started calling every single one. And so those conversations are the ones I referred to earlier. That being said, we know that there are a lot more organizations out there in the state that need to be included, and that have a lot to contribute, a lot of subject matter expertise, a lot of know-how, and a lot of experience in the addiction and recovery space. So I wouldn't say our list is fully comprehensive. But it was a good first start, we think. And then as the campaign rolls out and stories are being disseminated across the state, there's a lot of opportunity to learn as we go, to see what does really well, and then to take what we learn and refresh as we go. Webinars can change, outreach can change. None of this is set in stone other than the strategy that's behind it. And that we are taking people's own experiences and putting them in front of people. Aside from that, we can be pretty flexible. So, and that's part of why we're evaluating it at points along the way. But Weston, I figured you might have something to say here too.
Thanks, Joe. I was going to chime in here. Unfortunately, there is no exhaustive list of community-based organizations who are focused on prevention, recovery, and treatment throughout Pennsylvania. So one of our first tasks was to identify as many as we could throughout the state. So that's why we contacted each of the 47 SCAs, asked them for the recovery organizations in their area. We then had a list of those organizations, reached out to them, asked them to fill out a survey for us so we could get to know them better. And then those that didn't fill out the survey, we sent a little kind reminder email to them asking them to fill it out again. But as Joe mentioned, this list is by no means exhaustive. New organizations, are created every single day. So, I'd really request your help as organizations to spread the word about this campaign, and let us know organizations that you know that you don't see they're involved that might want to be involved. Again, this is a collective impact. It's going to take all of us for the success of this campaign. And we want to make sure that we get all the organizations involved who want to be involved in the campaign with that. And for example, after the press event yesterday, I had at least 4 different organizations reach out to me asking to be involved in the campaign. These are organizations that weren't already on our list. So there are a whole lot of organizations out there. I think we've identified about 360 throughout the state, which is great. And we're looking to add to that list as the campaign progresses. So please reach out, share the campaign with those you know. We'd love to have you involved.
Great, I think that's all the questions we have right now. Again, if there's any other questions that come up, I will put Maddie's email in the chat, as well as there will be a post-webinar survey coming to everyone who attended the call to really get your insights on what you thought of the survey and also to learn even more about your organizations. I'll also drop that link into the chat as well right now. Finally, next month's webinar will be on October 27th, and that will be led by Penn State and really going over the baseline data that Weston was talking about earlier. Weston, I don't know if you have anything else to add right here at all.
Sure. So we're going to really go over the baseline data in this next webinar on October 27th. We're going to, stress the importance of organizations using data and the decisions that they make. So ways that they roll out their programs, different channels that they might want to use, what's going to be most effective for their community. Because as we know, Pennsylvania is very diverse based on where you are. There are portions of the state that don't have access to high-speed internet access. So if you're an organization working, in one of those areas, your approach to getting your messaging out and your service is going to be much different, right, than organizations who are based in Philadelphia or Pittsburgh, where they have high-speed internet access everywhere. So really using the data that we already have and that we know to better understand your target audiences so that you guys can be most effective in what you do on a day-to-day basis. And further, whenever you apply for funding and grants, you have to supplement those applications with statistics from your local area. So where do you find those statistics? And then how do you use that data as well to evaluate your success going forward so you can continue getting that funding and improve the longevity of your organization. So this next webinar, we're going to give you some great information. It's also going to be a little bit hands-on as well to show you exactly where to find this and help you locate the data you need to be most successful wherever you are.
Thanks, Weston. And as Maddie and the rest of the team had also mentioned, looking for story submissions, and even if you want to fill out the content request that was earlier dropped into the chat, it will go right to Maddie to help you do the great work that you're already doing, and then she can get those testimonials to you. And finally, we would love for you to follow the accounts on social media. We've listed the handles for both Twitter and Instagram, as well as Facebook, at Life Unites Us PA for Twitter and Instagram, and at Life Unites Us for Facebook. You are free to contact Maddie. Her email is in the chat as well. We also just listed the campaign email if there are any other questions. But thank you for your patience. Thank you for attending. We're so happy that you are joined us today.
Thank you again, everyone.
Thank you.
Likewise, this is really amazing. So just so proud to be alongside all of you. Weston, Joe, this is fantastic, and your entire teams. This is great. Everyone from the state of Pennsylvania, if Jen Smith is still on the line, it's amazing. So thrilled and look forward to helping any way we can. Thanks.